I'm going to walk you through a need that we had that began in late 2021. Unfortunately, we had a similar incident in 2018 on traditional insurance. So I will walk you through the amounts. I kept the EOBs. So from the 2018 incident. So what happened in 2018? My son was 6 at the time, my eldest son. He decided to stand up on an end table, a thin end table beside our couch, and he got off balance. The whole end table and him hit the ground, and he cried for 20 minutes. I took him to the ER. At that time, the urgent care place was already, it was 7 p.m. on a Sunday night that our urgent care was already closed. The one that I knew about anyway. So we went to the ER. He did receive good care there. He's fine. He ended up getting a brace in, and then he ended up getting a cast. And at the time, my husband actually worked at the hospital, and we went through facilities that the hospital owned. So I have how much that cost us and how much was billed to insurance and all that good stuff, which I will go over in a few minutes. So, the same child, when he was 8, he was swinging on a backyard swing, and so just pretend like this is a swing, the bottom of it. When he went all the way up, he decided to let go, and he went straight down. He landed like, let's see if I can get the computer to look right. His wrist like this on this, landed on his arms. And I was inside, and I saw him out the window, heard him holler, and I saw out the window he was on the ground, and my husband was out there with him. And I think I ran quicker than my husband and beat him, even though he was out there, because I knew he really got hurt. So it was his wrists, both of his wrists this time. I gave him ibuprofen. I got some ice packs ready and sat him down, put the ice on him while I made an appointment, because I did not want to be sitting there waiting. I knew if I made an appointment in 30 minutes, I could get myself and him to the urgent care. We got there, and I kept his ice on him and stuff and explained what happened. When we got taken back, sure enough, he had broken both of his wrists. He had broken a total of 3 wrist bones. That's out of 4 wrist bones collectively on both wrists. So this time we used independent orthopedic group, and we used them for the whole process, and it went rather well for what it was. Now, I will say that since joining Samaritan, there's a resource on there called the Healthcare Bluebook, and I checked out our local hospital on a number of different, just kind of checking out different codes and stuff, and they are pretty much all in the red, which is not good. That means they're more expensive than most places in the area. Now, I will say about the hospital, they do give good care, but they're expensive. They are a nonprofit, but they're expensive. I've done that beforehand and learned that, and also they own a huge chunk of not only specialty groups, but primary care doctor groups in the city in which I live. And since I know that they are very expensive, I purposefully seek out independent practices for our family to go for healthcare. All right, so now that I've kind of laid the groundwork, we'll show you specifically the numbers. This is the information from 2018 when my eldest son broke one of his wrists by falling off of an end table. Okay, so went to the ER. Check out these numbers. Now, since I did state earlier, I had the EOBs, the explanation of benefits, so I saw what the insurance actually paid. They get massive discounts. They got massive discounts from the hospital. And then we went over here to what we owed. Now the radiologist charged this. Insurance paid nothing, and we paid that. The x-rays. That is a good chunk of money for x-rays. Insurance paid nothing, but it was discounted down. I have two different charges from the hospital. I'm sure one was the room charge. I'm not positive what the other one is. I don't have the actual EOB in front of me. But these were the charges they gave us. And insurance paid nothing on that, but it was discounted down to the $422. And the another charge was $134, and it was discounted down to $109. This is what our insurance paid the hospital for this one ER visit, and this was, oh, I know what one of these probably was. He did get his arm wrapped up in a brace, so that I'm sure one of these was for the brace, and then one of those would have had been for the room. That's what that was. So he went there. He was examined by a doctor. He had his x-rays done, and that is what all this is, and he got a splint put on. This is what we owed, and that is what our insurance paid. So next, we went to the hospital-owned orthopedic group. They're a great group. It's just expensive. This is the first time we went, and casting the wrist cost good bit of money there. All right, and then this is what we owed on the casting. We only had 2 more orthopedic group visits, and since the first one, I guess, was just right after the hospital visit, they were able to look at their x-rays, and they didn't have to re-x-ray him for this one. So they re-x-rayed him here to see how he's healing. And surprisingly little amount that we had to pay there. I'm not sure if I typoed that or what. I probably did type it. Well, no. I don't know how insurance decided this, because see, they paid $36 here for the x-ray, but then on the next visit they didn't pay any on the x-ray, and we got stuck with the full $43.05. It's a mystery sometimes, insurance. So, and then that's what that is. So we ended up owing for this whole ordeal. This was 1 ER visit and 3 visits to the orthopedic group over, a month. He only broke 1 wrist bone there. So anyway, we ended up owing $1,422.81 to the hospital and the orthopedic group, which is all owned by the hospital. Insurance total, they paid $5,752 to the hospital and the orthopedic group. Which, of course, even though the orthopedic group, I'll add this, they're owned by the hospital, they all use different billing systems and all that. Next up. So this is in 2021. I did ask him later why he let go of the swing, and he just said he thought he would stay on the swing. Alright, so after he hurt himself, I took him to urgent care. This was on a weekday, and it wasn't in the evening. My husband was actually off work that week, so it was during the day. So I took him to the urgent care, and the insurance rate was $150. Self-pay rate was $70. He had 2 forearm splints. I think they just charged us for 1. Anyway, the insurance rate and then the self-pay rate was that. The lady asked me where we wanted to go for the orthopedic stuff, and I told her I wanted to go to the independent orthopedic group. So she sent a referral, but since we don't have insurance, we're self-pay, we don't actually need one. We already knew this was going to be over $400 for this need. And I don't remember exactly when I put in the information to start the need, but I believe it was after I at least got the first itemized statement, either from the orthopedic group or it was not from urgent care. I did have trouble getting the itemized statement from them. But we actually probably won't be going there again, because not for something that could turn into a need, because their billing lady just was very unhelpful. And it took me over a month of contacting her and the place to actually get the itemized statement, which should not have been that difficult. Anyway, so I went to the independent orthopedic group, and they did give us itemized statements after I requested them. So this was the insurance rate and self-pay. And the cast placement, he only got a cast on one arm. They did not want to put him on both because they didn't fear he could be able to do anything. So he got it on the arm that had both of the bones broken. And that was actually the arm that he had previously broken one of the wrist bones. And then on the other wrist, he had like a fixed splint or brace. They called it a brace. Okay. And for anybody that has kids, before casting begins, just ask if they have the cast material that is waterproof. We did not do that, and it would probably have cost about the same, and it would have been a lot easier with a waterproof cast. And he had 1, 2, 3 more visits. The x-ray was left and right because he broke both wrists, and it was pretty smooth sailing. It was great to work with this particular group because once I got their email, I could just email and request the itemized statement. And it was just such a blessing to work with them. The self-pay rate, what we paid, was $1329.50. And the insurance rate would have been $1871. And this is using an independent group, not affiliated with the hospital where I live, and an independent urgent care. So I added all that up. This is how much Samaritan members will reimburse us. We've already been getting reimbursement checks. I'll have to check to see how much we have left. We're only in February, and it can take up to 2 or 3 months to get the reimbursements in. I mean, I submitted paperwork as it happened, as it came in, as soon as I could get the itemized statements. Okay, so we ended up paying for this whole need. It will have been probably like $404. We had one proration. That's where there are more needs than there is money coming into Samaritans, or allocated, I should say. And sometimes they do prorate a small percentage. Ours was prorated $4 a month, so we'll probably end up with only having to pay $404. Alright, so then just to go back, self-pay rate for this, because we didn't use the hospital, $1329.50 versus what we owed with insurance, $1422.81. He broke one wrist bone in that one, and in this one he broke 2, and this is like 2 years later. So self-pay can be a wonderful, wonderful thing when used in conjunction with Samaritan Ministries healthshare, and also using that Healthcare Bluebook to see what facilities are expensive and which ones are fairly priced.